This is Patrice Wendling at the ACC I2 Summit in Chicago, speaking with Dr. Joseph Rhodes-Cabot, who just presented some of the longest data follow-up on TAVI in the Canadian Experience. Doctor, what did you find regarding the valve durability?
In fact, what we found with valve durability is that the improvement that we saw in valve hemodynamics immediately after the procedure was maintained up to 3 to 4 year follow-up. And this was evaluated in a central echo core lab independently from the local investigators in the different centers participating in the study.
You were also looking at risk factors and predictors of cardiac death. What did you find there?
We found that patients who had pulmonary hypertension and chronic kidney disease were at higher risk for dying because of a cardiac death during the follow-up period. And this probably, and especially pulmonary hypertension, I would say, is maybe a marker sometimes of too advanced disease, that even with good result with the transcatheter valve may play this advanced disease might condition finally a cardiac death in the months, years following the procedure.
For all-cause mortality, frailty seemed to jump out as also one of the risk factors.
Yeah. What is interesting with these patients is that, with the frailty aspect, is that it seems that during the procedure and during the first year after the procedure, it doesn't seem to play a major role. It's after this first year where these patients that were classified as frail start to die more frequently than the rest of the study population.
Would you say that your study is providing us with some of the first insight into what may be the development of a TAVI risk score?
Yeah, in fact, there have been several studies looking at the factors and the prognostic factors, trying to improve the risk stratification of these patients before the procedures. Well, this is one step further because it's looking at longer term data, up to 3 years, and I think that this is one of the most important values of this study.
This is Patrice Wendling at the ACC I2 Summit in Chicago.